The thing that brought me to medicine is the fact that I don't like doctors. Lots of times when I'm having an interaction with someone in the office and I feel like there's a barrier or it's invisible, but there's kind of a tension, and they'll say, oh, I'm sorry, I don't like doctors. And I always say, I don't either. That's why I became one, because then I figured if I was one, I never had to see a doctor again. And you can just feel them kind of relax and go, oh, we're dealing with people, which is always, I think, a comforting thing for the patient, and it feels like it puts them at ease. A patient experience that had an impact not just on how I run my practice, but on how I interact with everybody I see in a day isn't really a patient of mine, but it was an experience that my grandmother had. She needed a knee replacement, and she went into her doctor, and he said, you need a knee replacement, this is what it is, explained it to her, and she said, how much is it going to cost, of course, because that's what grandmas do, they're practical and brought up and lived through the Depression. And he told her however much it was that it was going to cost, and she said, that's too much, it's not worth it. And he said to her, I will do this for you, and all that I will charge you is what your insurance covers. There won't be anything additional, just the basics, just to cover the hospital fee, but the rest I won't charge you, because this will make such a difference in your life. And I wish that medicine were a barter system, actually, because I would love to treat people for a dozen eggs or a loaf of bread. I think the insurance and the money part kind of mucks it all up, but that's what has influenced how I treat people, is I don't pay any attention to the economics of it all, but just go in and see what you can do for somebody to try and make their life a little more pleasant.